Listen. We have seen what is pulmonary circulation. Yes or no? Yes or no? We have seen what is systemic circulation. We have seen what is systemic circulation. Now, in this pulmonary circulation and in this systemic circulation, when you're talking about systemic circulation, there is a special part which is called as aorta. There is a special part which is called as aorta. Now, exactly, we'll see what is this aorta. Exactly, we'll see what is this aorta. Okay. Now, everybody, you have drawn that picture. Yes or no? Yes. Everybody, you have drawn that picture. Now, I'll also. The shape is like an arch, and it's just like an umbrella which is bent. Yes or no? It is just like an umbrella which was bent. Now here, when you see the upper, when you see the arch, there are three kinds of other arteries which are arising. Yes or no? Yes, sir. So we have first artery, we have second artery, we have third artery. Exactly, what are these arteries? Exactly, what are these arteries? Now, this first one is again divided into two types. This first one is again divided into two types, and second one is going as it is. Third one is also going as it is. Now, what is this arch of aorta? What is this arch of aorta? What are the parts that are involved in this arch of aorta? What are the parts that are involved in this arch of aorta? And how this arch of aorta? Now listen to me. Now it is the largest artery which is measuring about 2 to 3 centimeters. 2 to 3 centimeters. Yes or no? Now what is the diameter here? It is about 2 to 3 left ventricle. It is arising from which place? Left ventricle. It is arising from left ventricle. So here it is. So you call this as ascending aorta. You call this as ascending aorta. You call this as ascending aorta. Why you are calling it as ascending aorta? Because this part, whatever you are seeing, is going upward direction. Is going what? Upward direction. Is going what? Upward direction. Now, what is this arch of aorta? Am I clear? We have ascending aorta. Now, where are arteries which are arising here? Who is Anjali? Please listen. Now, when you take this arch of aorta, समझ में आ रहा है आपको? ये ऊपर जा रहा है इसलिए इसको ascending कहते हैं. नीचे से किधर जा रहा है? ऊपर जा. अगर ऊपर से नीचे है तो descending कहते हैं. अभी क्या हो रहा है यहाँ पे? नीचे से ऊपर जा रहा है. కింద నుంచి పైకి వెళ్తే ఏమంటామా? ascending అన్న. పై నుంచి కిందకి వస్తే descending. సో ఇప్పుడు మనకు తెలుసు. तो अब हम मानते क्या है? ये नीचे से ऊपर जा रहा है इसलिए हम इस पार्ट को क्या कहते हैं? ascending. ఇప్పుడు చాలా మంచిగా ఉంది. ascending aorta. What is this arch of aorta actually? Why they are calling means because of the shape. Just because of the shape, they are calling it as arch of aorta. Sir, what is the significance of this arch of aorta? What is the significance of this arch of aorta? Now, can you see any kind of extensions in ascending aorta?
No.
Is there any extension?
No, sir.
Is there any extension?
No, sir.
No. But when you talk about arch of aorta, you have 3 terminals which are coming out. How many are coming out? 3 terminals. So, first one, whatever you are seeing is called as, this part is called as brachiocephalic artery. It is called as brachiocephalic artery. Now, you have to think about this particular part. Now, if you take this as arch of aorta, so there is a one artery. Now, this particular brachiocephalic artery, brachial, which is related to brachial, which is related to toll తీసేతను lungs అన్నారంట. Why lung? Lung ki cephalic ki sorry, brachio is present in lung. You are not getting my point. Adi bronchioles. This is brachial. I have discussed you regarding the circulation of upper limb. Yes or no? I have discussed you what is the circulation of upper limb. What is the circulation of upper limb here? It is coming from base brachiocephalic artery. It is coming as subclavian artery. Yes or no? From subclavian artery, axillary artery. From axillary artery, brachial artery. From brachial artery, radial and ulnar. So, as you can see, since this is going as subclavian artery, so this is called as brachio because it is supplying blood to the hand. It is not lung, it is supply. If I say bronchial, it is related to lung. I am talking about brachial. Don't get confused. Am I clear? Brachial means hand. This cubital fossa, whatever the bending is there near the elbow, this particular region is called as brachial region. Am I clear? Now bronchial is separate. I'm going to teach you about bronchial. Don't worry about that bronchial circulation. I'm talking about the first ascending first artery which is arising. Am I clear? So this is brachiocephalic artery. This one is called as what, ma? Brachiocephalic artery. Now what is this brachiocephalic artery? It is the first artery which is arising in the arch of aorta. It is the first coming artery which is arising in the arch of aorta. And this particular arch of aorta, how it is divided means it is divided into these two parts are there, no? Yes or no? So first one is called as brachiocephalic. One part is going as brachiocephalic. So one part is going as brachiocephalic. This brachiocephalic is divided into two types. First one is right subclavian artery. First one is what, ma? Right subclavian artery. First one is what, ma? Right subclavian artery. Now we have the second artery which is called as right common carotid artery. Right common carotid artery. Right common carotid artery. I'll simplify you. Listen carefully. थोड़ी नीचे आके समझते. Okay? एक बार देखो. अम्मा नाकु चॉकपीस कावाले. फटाफट नी నాకు మన చాక్పీస్ పెట్టే. పొడుగ్గా ఉన్నాయి పెట్టు. Now when you look at here, you take aorta. What we are taking? Aorta. Now aorta is divided into ascending aorta. Aorta is divided into ascending aorta. Now this ascending aorta is giving rise to arch of aorta. It is giving rise to arch of aorta. Now this arch of aorta is divided into three. This arch of aorta is divided into three. Now arch of aorta is further extended. So first you are calling it as ascending aorta. Ascending aorta is further divided into arch of aorta. This arch of aorta is going as a descending aorta. This arch of aorta is going as descending aorta. Now I am talking about parts which are involved in the arch of aorta. I am talking about only the parts which are involved in the arch of aorta. Again, don't get confused. Arch of aorta is further extended as descending aorta. But we are discussing about the special three outlets which came near the arch of aorta. These are the special three outlets. समझ में आ रहा है? आ जाओ. अम्मा अट जाएगा अम्मा अम्मा इच कुछ उठा दंट. हाँ वो बेच में बैठो. Am I clear? Yes or no? Now, what is this first part? So this one is called as brachiocephalic artery. This one is called as
Brachiocephalic artery.
Now, with the name itself, we can understand that brachio related to hand, cephalic related to head. Cephalic related to head. That means these arteries are giving blood supply to hand and head. Hand and head. So we call it as, since this is in towards the right side, first one is right subclavian artery. First one is what, ma?
Right subclavian artery.
So we will write here. Right subclavian. Right subclavian
Artery.
Clear? Yes or no? Yes or no? So this one, this particular arch of aorta, first it is giving rise to brachio. Artery is divided into two types. First one is subclavian artery, and second one is right common carotid. Clear? Clear? So the first part is called as brachiocephalic artery. Brachiocephalic. What is the second extension? This second one is particularly, this particular thing which is coming out is called as what is there, ma? Carotid artery. What is this, ma? Left common
Carotid artery.
So second extension arch of aorta, can I write left common carotid?
Artery.
Yes or no? Now what is this third part? Now you have carotid artery. First one is giving rise to two types. Right hand it is supplying, brain it towards the head it is going. Second one is also going toward head. Now what is remaining? Left hand. This left hand is supplied by the third extension, which is called as left subclavian artery. Now left subclavian artery is further divided into axillary artery. Yes or no? From subclavian, axillary. From axillary, brachial. From brachial, radial and ulnar. Radial and ulnar. Am I clear? Yes or no? Now what is happening here? Palmar arches. I told you what are the arteries that are involved in the arch of. Now what are the arteries that are involved? It is involving mainly four types. First one is brachiocephalic. Brachiocephalic is divided into two types. First one is right subclavian. Second one is second extension is left common carotid artery, and third extension is
Left subclavian artery.
left subclavian.
Artery.
Am I clear?
Yes,
Yes
sir.
or no?
Yes, sir.
Yes or no?
Yes, sir.
Listen carefully. Now this part, whatever this part is coming down or going up. So you call it as descending up. You call it as descending. Clear, Amma? Yes or no? Now look into your textbooks. According to the location of aorta, it will be described into, according to the location మాట్లాడుకున్నా అయోటా. దేనికోసం మాట్లాడుకున్నామమ్మా? అయోటా. ఇప్పుడు ఈ అయోర్టా అనేది ఏదైతే ఉందో ఇది లెఫ్ట్ వెంట్రికల్ నుంచి బయటకు వస్తుంది మనకి. సో లెఫ్ట్ వెంట్రికల్ నుంచి పైకి తన్నుకొచ్చింది కాబట్టి కొంచెం పార్ట్ ని దాన్ని అసెండింగ్ అన్నాం. అంటే కింద నుంచి పైకి వెళ్తే ఏమంటాం? అసెండింగ్. సో ఒక చోటకు వచ్చిన తర్వాత ఇలా బెండ్ అయింది కాబట్టి దీన్ని బెండ్ ఆర్చ్ లా ఉంది కాబట్టి ఆర్చ్ ఆఫ్ అయోటా అన్నాడు. ఇక్కడ కిందకు వచ్చింది కాబట్టి డిసెండింగ్ అయోటా అన్నాడు. అర్థమైనా తల్లి? సో ఇప్పుడు మనం రీజన్స్ ఆఫ్ బాడీ కోసం మాట్లాడుకున్నామా లేదా? సో ఇది ఏమనుకున్నాం? థొరాసిక్ రీజన్, ఇది అబ్డోమినల్ రీజన్, ఇది పెల్విక్ రీజన్. ఎదురుంటే వెంట్రల్ అని, బ్యాక్ ఉంటే డోర్సల్. ఎదురుంటే యాంటీరియర్ అని, बैक ఉంటే पोस्टीरियर. क्लियर है? सुनो आपको बोल रहा हूं मैं, देखो हम रीजंस का बारे में क्लास लिया था पहले। क्या है, अगर कोई ऑर्गन थोरैसिक रीजन में तो हम क्या कहते हैं इसको, थोरैसिक ऑर्गन। अगर अब्डोमेन में तो अब्डोमिनल ऑर्गन, अगर पेल्विस में है तो पेल्विक ऑर्गन है कि नहीं, अगर क्रेनियल कैविटी में है तो क्रेनियल। सो ये जो बात कर रहा हूं मैं अभी, अयोटा था ना, अयोटा, अगर ये थोरैसिक रीजन में है तो इसको क्या कहते हैं हम, थोरैसिक अयोटा। अगर नीचे अब्डोमेन में आ गया तो क्या कहते हैं हम, अब्डोमिनल अयोटा। अब समझ में है ना, थोरैसिक अयोटा मतलब क्या, अब्डोमिनल अयोटा मतलब। अब देखो थोरैसिक अयोटा में क्या क्या रहते, अब्डोमिनल अयोटा में क्या क्या रहते, हाँ सुनो। What are the regions that are involved in thoracic aorta? So there are exactly three parts which are present in thoracic aorta. What ma? There are exactly three regions which are present in thoracic aorta. What are the three regions that are present? What are the three regions that are present in thoracic aorta? Now we have ascending aorta, arch of aorta, and descending. So these are the three regions of aorta that are present in the thoracic region. That are present in the thoracic region. Now we'll talk about the ascending aorta. I already said you this is the short section of aorta. This is what ma? Short section of aorta, which is this is the short section of aorta which is arising from the heart, which is arising from the heart. Now from the heart, this short section, so from the left ventricle or right ventricle, left ventricle, you should be damn there on the point. When I'm talking about aorta, left ventricle. When I'm talking about pulmonary artery, right ventricle. Aorta, left ventricle. Pulmonary artery, finish. You're getting my point? You should be right on the note. Left side, deoxygenated blood. Right side, deoxygenated. Amma. Left side empty. Right side empty. Mali, if I hear it again wrong, okay. Next appudu KGF. Listen carefully. Now we have the parts that are coming from the thoracic aorta. We have the parts that are coming from, that are there in the thoracic region. So what are these parts of thoracic aorta? Means we have ascending aorta, we have descending aorta, and we have arch of aorta. Now exactly what is the location of this arch of aorta? So it is the short section of aorta. It is the short section of aorta में जो छोटा है इसका कितना सेंटीमीटर बोलेगा तो 5 सेंटीमीटर. कितना सेंटीमीटर में 5 सेंटीमीटर. एनी सेंटीमीटर लंबा 5 सेंटीमीटर. And it lies behind the sternum. It lies behind the sternum. Sternum मतलब क्या है? Sternum मतलब क्या? Between the
two lungs.
It is between the two lungs, that is fine. But what is exactly sternum? Sternum is nothing but which is adjoining the ribs. Which is adjoining the ribs. So whatever the thoracic ribs are there that are coming and joining to your sternum. That is coming and joining to your sternum. You get my point? You get my point? So we have this sternum which is present mediastinally. Center of your body. Yes or no? Yes. So behind the sternum, Now sternum is the thoracic region. If you look at your sternum, you can actually feel it. You can actually feel it if you want to check. Until one part of your abdomen only, this sternum is present. Yes or no? So exactly this part is called as thoracic cavity, and here your aorta is there behind the sternum. Is there behind the sternum. Now listen to me carefully. The right and left coronary arteries are its only branches that arise from the aorta just above the level of aortic valve. What were? The right and left coronary arteries are its only branches. The right and left coronary arteries are its only branches. Now, he is saying about coronary. He is talking about coronary. Coronary means related to coronary circulation, coronary circulation, coronary circulation. That means you are not listening the class perfectly. I told you clearly what is coronary circulation. Now entire class will be standing up and listening the class if you are not saying this answer. I told you clear, last 3 days our classes were on this coronary circulation. I'm discussing about circulation of, stand up everybody, stand up, stand up, stand up, stand up, stand up. You have to stand up, that's it. Now I'm discussing about circulation of heart. I'm discussing about what? Circulation of heart. Now this circulation of heart is having left coronary artery, right coronary artery. I told you or not? Left coronary artery is divided into two types. What? Left side amma. Cheppandi. Left is left circumflex artery and right anterior. One person. Anterior interventricular artery. What is the circulation? Coronary circulation. Yes or no? I told you clearly, this coronary circulation is receiving blood from aorta. Yes or no? Now which part of aorta means ascending aorta? Which part of aorta? Ascending aorta. Did you remember the heart diagram? Did you remember the heart diagram? So when you remember, if you remember exactly what is the heart diagram, I told you several times. Second time kuda somebody came to me and asked the doubt. Yes or no? I told you clearly from since it is in the posterior side, it is where it is located base of near the base of the heart. It is coming. Since mostly it is there in the posterior side, you might not see ma, but two extensions are coming. One is left and one is right. Exactly. This is where ascending aorta will gives rise to two types of arteries. How many types of arteries?
Two types of arteries.
Left coronary artery and
Right coronary artery.
it is right
Coronary artery.
How many arteries are coming from aorta? Ascending aorta? Two types. Left coronary artery.
Right coronary artery.
Left coronary artery.
Right coronary artery.
Clear? Did you understood? Forget about arch of aorta. Immediately when the artery is coming out, when the ascending aorta is coming out, the aorta has two parts. Aorta mainly, first part is called as ascending aorta, and it has two parts. These two parts are nothing but blood vessels which are supplying blood to heart. Right coronary artery, left coronary artery. Right coronary artery,
Left coronary artery.
sit down. మీరే చెప్పండి. హార్ట్ కి బ్లడ్ సప్లై ఏమంటాము? బ్లడ్ సప్లై టు ది హార్ట్ is ఇప్పుడు దాకా till now we have discussed that same topic. Am I clear? Yes or no?
Yes, sir.
What is called as blood supply circulation to heart? Listen to me carefully. How many types of circulation are there? Mainly three types of circulation are there. How many types are there? Three types. First circulation is pulmonary circulation. Second circulation is third circulation. Agan, మీరు చెప్పండి. What is third type of circulation? అర్థమవుతుందమ్మా క్లాస్? మీ క్లాస్ అర్థమవుతుందో లేదో నాకు కావాలి. So without listening, if you sit in class, it is of no use. I know candidates who are not listening to the class. बोलो, तीन सर्कुलेशन बोलो. पहले वाला क्या है? बोल. कोरोनरी सर्कुलेशन. दूसरे वाला आगन्ना मैम. हाँ, अब आप वैसा करो. आप उठो. आप, तुम्हारा दोस्त है ना वो? नुबे you only. What are the three types of? She is from West Bengal? No. You sit down. आप उठो, आप నువ్వు కదమ్మా, ఈమె ఆ, అమ్మా నువ్వు కాదు, నీ వెనక. ఆ, హిందీలో చెప్తున్నానంటే తెలుగులో ఎందుకు చెప్తున్నామ్మా? बोलो, आप बोलो, कितने सर्कुलेशन है बॉडी पे? 3 सर्कुलेशन. पहले वाला क्या कहते हैं हम? सिस्टमिक सर्कुलेशन एक है, मतलब जो बॉडी और हार्ट की तरफ से, और दूसरे क्या है? पल्मोनरी सर्कुलेशन. इसको क्या कहते हैं? सर्कुलेशन बिटवीन heart and, yes or no? Yes, I wrote clearly. One answer is here itself, systemic circulation, which is happening between the body and heart. Yes or no? And second one is pulmonary circulation. I wrote it here. I just erased. Lungs and heart. What is the one more circulation? Coronary
circulation.
Madam, చెప్పండి, ఇప్పుడు ఏం చేద్దాం? క్లాస్ వింటున్నారా? ఎందుకు బ్యాక్ కూర్చుంటారు? ఇంట్రెస్ట్ ఉందా లేదా? ఇంట్రెస్ట్ లేకపోతే ఫస్ట్ ఇదే. మళ్ళీ మధ్యలోకి వెళ్ళిన తర్వాత ఇంట్రెస్ట్ లేదని అప్పుడు తెలుసుకుంటే ఏం చేయలేం. ఇంపోజిషన్ రాశారా? రాయలేదు. రాశారా? నిజం చెప్పండి. కూర్చోండి, క్లాస్ వినాలండి. सिट डाउन. यू हैव टू लिसन टू क्लास. क्या सोच रहे हैं? घर का बारे में सोच रहे हैं? अगर घर जाना है तो बोलो, मैं साहब से बात करके तुमको छुट्टी मिलने की तरह कोशिश करूंगा. जरूर मिलते छुट्टी. एक लेटर आप लिख के मेरे को पर्सनल रीजन में घर जाना बोलेगा तो देते छुट्टी. देते छुट्टी में मिलने में तकलीफ नहीं है. अब बैठो जी, स्टैंड अप. असेंडिंग आयोटा भी मैं बोला ना, असेंडिंग आयोटा से कौन से आर्टरीज निकला है? हाँ, 2 आर्टरी बोला. आर्टरी कौन है? देखो बहुत सिंपल है, बहुत आसान है, कॉम्प्लिकेट मत करो. सुनो, हमको पूरा बॉडी के लिए ब्लड सर्कुलेशन चाहिए. क्या चाहिए? पूरा बॉडी के लिए ब्लड सर्कुलेशन चाहिए. हार्ट के लिए भी ब्लड सर्कुलेशन चाहिए. लेकिन हार्ट का ब्लड सर्कुलेशन कहां से शुरू हो रहा है बोलेगा तो असेंडिंग आयोटा बोल के एक पहला आर्टरी था जो लेफ्ट वेंट्रिकल से निकला रहा है. वो लेफ्ट वेंट्रिकल से ऊपर आ जा रहा है बोल के हम क्या कहते हैं? इसको असेंडिंग आयोटा कहते हैं. इसका लेंथ जो है वो 5 से 4 सेंटीमीटर है, बस 5 से 4 सेंटीमीटर. अभी जो असेंडिंग आयोटा के बारे में बोल रहा हूं, असेंडिंग आयोटा से 2 आर्टरी निकला रहा है. पहले वाला लेफ्ट कोरोनरी आर्टरी और दूसरे वाला राइट कोरोनरी आर्टरी. मतलब असेंडिंग आयोटा से कौन सी ऑर्गन को ब्लड सर्कुलेशन जा रहा है तो बोलेगा तो हार्ट को जा रहा है. किधर जा रहा है? हार्ट. यहाँ पे हार्ट सर्कुलेशन बोलेगा तो हम लोग क्या कहते हैं? कोरोनरी सर्कुलेशन कहते हैं. तो कोरोनरी सर्कुलेशन कहां से शुरू हो रहा है? असेंडिंग आयोटा पे शुरू हो रहा है. बड़ा आर्टरी 2 है. कौन सा बड़ा आर्टरी का नाम क्या है? पहले वाला हम क्या कहते हैं? राइट कोरोनरी आर्टरी. और दूसरे वाला हम क्या कहते हैं? लेफ्ट कोरोनरी आर्टरी. समझ में आया ना? हाँ, इसको उठाओ. आप उठो, आप उठो. आप नहीं बोलो. असेंडिंग आयोटा कहां से शुरू हो रहा है? अभी बोला ना? हाँ, समझ में आया? पूछा तो आप लोग क्या बोला? समझ में आया बोला. हाँ, okay. This is your fate. I cannot change it. Okay, I'm trying to come down as possible, but you are not listening. Sit down. That's your mistake, not my mistake. Now I'm talking about ascending aorta. Ascending aorta is giving rise to 2 types of major arteries. Mainly coronary circulation is arising from it. What is arising? Coronary circulation. So coronary circulation means we have two types of arteries: left coronary arteries, right coronary. Finished about ascending aorta. Talking about arch of aorta. When you talk about arch of aorta, there are mainly three types of extensions which are coming. First one I am calling it as basocephalic artery. This basocephalic artery is divided into two types. First one is right subclavian artery. Second one is right common carotid artery. Second one is left common carotid artery. Third one is left subclavian artery. And so we are done with the arch of aorta. We are done with the arch of aorta. Now, what is this descending aorta? This descending aorta is the largest type of artery. It is the largest type of artery which is present in the body. Now, where it begins means when the artery is ending, this particular region, when the artery is ending this particular region, this is arch of aorta. So this from here it is beginning and it is extending till the pelvic region. It is extending till the pelvic region. Now, this descending aorta, as it is shown at the level of fourth thoracic vertebrae. What ma? Fourth thoracic vertebrae. There are vertebrae in your body. What are there? Vertebrae in your body. What are these vertebrae? You call it as vertebral column. You call it as what ma? Vertebral column. What is this vertebral column? What is this vertebral column? What is this vertebral column? Vertebral column means nothing but the like whatever the skeletal system is there, your ribs are attached to these vertebral bones. Yes or no? So when the vertebra is passing, we are vertebrates or invertebrates? We are vertebrates because we have not spinal cord, we have vertebral column. We have what ma? Vertebral column. Now exactly when you are talking about this vertebral column, vertebral column, this vertebral column is protecting, is extending a spinal cord. The brain is extending a spinal cord in our vertebral column. Now till here it is fine. Now you are talking about thoracic vertebrae. We have cephalic vertebrae, we have thoracic vertebrae, we have lumbar vertebrae. Yes or no? We have sacral vertebrae. Yes or no? We have coccix. We have what ma? Coccix. So this is first GNM classroom. That's why the image is not there. Okay, fine. Now when you are talking about descending aorta, they are present at the level of fourth level of thoracic vertebrae. Fourth level of thoracic vertebrae. Now here the descending aorta is divided into two portions. The descending aorta is divided into two portions. First portion is called as thoracic and second portion is called as abdomen. First portion is called as thoracic and second portion is called as abdomen. Now in thoracic region itself we have descending aorta. Yes or no? Yes or no? So this descending aorta is divided into two types, thoracic and abdominal aorta. Within the abdomen, the descending aorta branches into common iliac arteries. Within the abdomen, it is dividing into common iliac arteries. What ma? Common iliac arteries. Now, how many iliac regions are there? Single or two? One is right. One is right. One is right. One is right. So, common means both the arteries not yet divided. Both the arteries not yet. If you see figure number 4.13, now look at this. This one, whatever it is there, this is called descending arch of aorta. Now here it is dividing into two. Before it gets divided, this is called as common. Now here, what is happening? Right iliac artery and left iliac artery. Right iliac artery and left iliac artery. Am I clear? Yes, sir. Yes or no? Yes, sir. Now we'll talk about abdominal aorta. Now abdominal aorta is the largest artery which is there in the abdominal cavity. If it is there in the thoracic cavity, you call it as? Amma, you are not attentive. If it is in thoracic cavity, you call it as? If it is in abdomen, you call it as? If it is in thoracic, first you don't try to give answer first. Okay, try to listen the question first. Think and then give answer. Am I clear? Don't try to give your answer first itself. First cheppedam valla nothing will happen. You're understanding? Don't try to spell your answer first. Hello. Why you are not listening? क्या बोल रहा हूं मैं? कोट. हाँ. Then यहाँ पे ध्यान दे दो. Sit down. If I find anyone not listening, you will be out of the class. Pakka. Don't test my patience. Listen. So we are discussing about abdominal aorta. We are discussing about what, ma?
Abdominal aorta.
What is this abdominal aorta? Because it is in the abdominal region, you call it as?
Abdominal aorta.
You call it as?
Abdominal aorta.
If it is there in thoracic region?
Thoracic aorta.
It is called as?
Thoracic aorta.
How you will call? I'm sorry, ma. But you have to listen. If you are not listening, you are testing. That's it. How many times I told you, please pay attention, please pay attention, please pay attention. Okay. If you are not listening, I cannot do anything. You have to listen in class. That's it. If you don't want, please write a letter and give it to them that we don't want the class and we don't want this lecture. Finish. Some other person will come, some other person will teach you. Do you understand? Okay. So we are preparing the class and we are coming here. That's up to you. If you listen, it's good for you and me also. If you do not listen, that's fine. Okay. Now you're talking about abdominal aorta. What is this exactly? Abdominal aorta means this abdominal aorta is the largest artery which is present in the abdominal cavity. Now it is a direct continuation of the descending aorta. What it is? Direct continuation. What is direct continuation? Now this is descending aorta. This descending aorta is cut down here. No. Directly it is divided. Directly it is divided. It is divided into two types. First one is right iliac artery. Second one is left iliac artery. That means iliac means it is supplying to right lower limb and left lower limb. Am I clear? Yes or no? Yes or no? Now listen to me. It begins at the level of diaphragm, crossing it through the aortic hiatus behind the diaphragm at vertebral level of T12. So T12, it is the last vertebrae in the thoracic cavity. Yes or no? It is the last vertebral column which is present in thoracic cavity. Now, what is dividing the thoracic cavity and abdominal cavity? What is dividing thoracic cavity and abdominal cavity? Diaphragm. Yes or no? Yes or no? Yes or no? Now, when you talk about, so it is crossing the level of diaphragm. When it crosses the diaphragm, officially it has entered into the abdominal cavity. Officially it has entered into the abdominal cavity. Am I clear? Yes or no? Yes or no? Now, this abdominal aorta is crossing the diaphragm at T12 level. At T12 level, and it is crossing the diaphragm and entering into the abdominal cavity. That's why you call it as abdominal aorta. Where it begins at the T12 level when it crosses the diaphragm. When it crosses the diaphragm. Now listen to it. It travels down the posterior wall of the abdomen. Posterior side means dorsal side or ventral side? Dorsal side. It is passing through the dorsal side. It is passing through the dorsal side. Now posterior wall of the abdomen, anterior to vertebral column. What is anterior to vertebral column? Posterior to vertebral column means back side of the vertebral column. Anterior to vertebral column means in front of vertebral column. Where it is passing? In front of vertebral column. Am I clear? Yes or no? Next. It runs parallel to the inferior vena cava. It runs what, ma? Parallel to the inferior vena cava. Exactly. What is this inferior vena cava? What is this inferior vena cava? What is this? What is the function of inferior vena cava? From which part of the body? Lower part of the
Body.
yes or no?
Yes,
So
sir.
lower part of the body means it is involving lower, 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 also the abdomen, also the and some part of the thoracic region. Yes or no? Now we have great veins. These great saphenous vein is there, which is present in the leg, which is present in the otherwise you call it as lower limbs. Otherwise you call it as
Lower limbs.
now from pelvic region we have pelvic organs which give the oxygenated blood. That blood is entered into the inferior vena cava. Abdominal region, abdominal organs, blood is entering into the inferior vena. So to show you exactly how it runs, I try to put a diagram. Now, so this is your vertebral column. This is your vertebral column. Just imagine, okay? Just imagine. Just give me 1 minute. Now, when you talk about the vertebral column, now vertebral column is present in the cervical region. It is present in the
Cervical region.
cervical region. How many vertebrae are involved in cervical region means how many vertebrae are involved in cervical region means we have 7 vertebrae. How many vertebrae? 7 vertebrae. Now we have vertebrae which is involved in the thoracic region, which is there in the thoracic region. How many are involved means here 12. How many ma? 12 vertebrae. How many ama? 12. Now it is further extended as lumbar. So how many are involved means 5. How many are involved ma? 5. Then we have sacrum. Which is a fused vertebrae. Now these are not fused. They are movable. That's what you are bending like this, bending forward, bending backward, bending downward, because the vertebra is flexible. Now if it is fused, if it is straight bone, can I bend like this? Can I bend like this? Can I bend laterally? Can I bend yes or no? Now if you now you are turning your neck like this because the vertebra is flexible. If it is fused vertebra, when you are turning, entire body has to turn like this. Am I clear? Yes or no? Now, what is the significance of vertebra in this aorta means now T1, T2, T3, T4, 5, 6, T12. Now this is where your thoracic cavity is ending. This is where your thoracic cavity is ending, and here only the diaphragm is present. Passing the diaphragm, descending aorta is entering into abdominal region. Your descending aorta is entering into abdominal region. Now abdominal region begins at the L1 level, lumbar level. Am I clear? Yes or no? L1, L2, L3, L4, L5. Lumbar vertebrae 1, lumbar vertebrae 2, 3, 4 and 5. Lumbar region. Yes or no? So now you know clearly thoracic vertebrae 12 are there. How many are there? 12 are there. Here I said to you why I am drawing this means now after lumbar we have sacrum. After lumbar we have sacrum, which is involving your pelvic bone, which is there in your pelvic bone. Now these two ischial bones, are fused to the sacrum. Are fused to where ma? Sacrum. So here till yesterday also there we have seen pelvis there. If you could remember pelvis, I told you 5 fused bone. I told you 5 fused bone, and coccix is a 4 fused bone. How much ma? 4 fused bone. Now you are talking about this part. So here I told you one is coming. What is this? How your aorta run? Descending aorta. I want red chalk please. If you think green as a vein, if you think green as vein, you think red as artery. Now, artery is coming like this. Parallelly, the vein is also going. Am I clear?
Yes.
The vein is all. So this part is inferior vena cava. This part is inferior vena cava. Am I clear? This part is what ma? Inferior vena cava. This is descending aorta. This is descending aorta. Now, if it is between the thoracic vertebrae, that means 12 thoracic vertebrae, you call it as thoracic aorta. You call it as
Thoracic aorta.
if it is near the thoracic vertebrae, you call it as thoracic aorta. If it is crossing the T12 level and entering lumbar, you call it as abdominal aorta. You call it as
Abdominal aorta.
now you understood? So when you call thoracic aorta, when you call abdominal aorta, okay, I'm not going to ask questions. Just I'll go with the class. Okay, next one. It runs down the posterior wall of abdomen, anterior to vertebral column. It runs parallel to inferior vena cava, which is located just right of the abdominal aorta. Just right of the abdominal aorta. Am I clear? अर्थाइंदा अर्थाइंदा समझ में आया सच बोल understood that back girl understood మన క్లాస్ వింటేనే కదా सुनो यार circulation of blood to head and neck circulation of blood to head and neck circulation of blood to head and neck. Now this is where you have to remember your arch of aorta. This is what you have. This is where you have to remember your arch of aorta. Yes sir. कभी सोचा हार्ट हेड किस तरफ रहते, ऊपर रहते नीचे रहते? हाँ, हेड ऊपर रहते नीचे रहते? ऊपर. सच में? हाँ हाँ. हेड का काम क्या है? बॉडी कंट्रोल. हेड का काम क्या है? बॉडी. इसको क्या कहते हैं हम? सेंट्रल प्रोसेसिंग यूनिट ऑफ योर बॉडी. ऐसा ना सीपी ऑफ आवर बॉडी, क्योंकि यहाँ पे पूरा लर्निंग, लिसनिंग, वॉकिंग, कोऑर्डिनेशन, पूरा बॉडी का फंक्शन यहाँ पे शुरू होता है. फिर हेड के लिए हमको क्या चाहिए? ब्लड चाहिए, खून चाहिए. ఏమా తల పైన ఉన్నదా కింద ఉందా?